Welcome to the first of a two-part series on insulin resistance. Today we're going to dive into what exactly insulin resistance is and why it's something women over 40 should pay close attention to, so stay tuned. Insulin resistance occurs when your body's cells don't respond well to insulin, which is a hormone produced by the pancreas that helps regulate your blood sugar levels. When you eat, your body breaks down carbohydrates into glucose, which then enters your bloodstream. Insulin's job is to help glucose enter your cells to provide them, and thus you, with energy. However, when you're insulin resistant, your cells don't respond properly to insulin, causing your pancreas to produce even more insulin to try to compensate. This eventually leads to higher than normal levels of insulin in your bloodstream, which can have serious health implications. Insulin resistance is prediabetes and can be thought of as the gateway to virtually all chronic diseases because of its profound impact on various bodily functions. Recent studies have shown that more than half of adult Americans are already insulin resistant. Here are some of its implications. Insulin resistance disrupts the body's ability to regulate blood sugar levels effectively, so glucose remains in the bloodstream instead of being taken up by cells for energy. Insulin resistance triggers a cascade of inflammatory responses in the body. Inflammation is linked to the development of chronic diseases such as cardiovascular disease, arthritis, and certain cancers. Insulin resistance affects the function of endothelial cells, which line the interior surface of blood vessels. Dysfunction in these cells contributes to the development of atherosclerosis, a condition where plaque builds up in the arteries, leading to heart disease and stroke. Insulin resistance often goes hand in hand with abnormal lipid profiles, characterized by elevated triglycerides, low HDL cholesterol, and an increase in small, dense LDL particles. This lipid profile is a significant risk factor for cardiovascular disease. Insulin resistance can also disrupt hormonal balance in the body, particularly affecting hormones such as leptin and adiponectin, which regulate appetite and metabolism. This imbalance can contribute to weight gain, obesity, and further exacerbate this condition. Insulin resistance can cause oxidative stress, which damages cells, proteins, and DNA, contributing to the development of chronic diseases like diabetes, neurodegenerative disorders, and cancer. Insulin resistance affects liver function, leading to increased production of glucose by the liver and abnormal lipid metabolism. This can result in non-alcoholic fatty liver disease, a condition associated with insulin resistance and a precursor to more severe liver conditions such as cirrhosis and liver cancer. Overall, insulin resistance sets the stage for a multitude of chronic diseases by disrupting metabolic, inflammatory, hormonal, and cellular processes in the body. Managing insulin resistance through lifestyle modifications and appropriate medical interventions is crucial in preventing the development and progression of these chronic conditions. Your vibrant habit is to look out for part 2 of this series to find out what the signs of insulin resistance are and how to prevent or even reverse it. If you liked this video, try this one next. And please subscribe to my channel so I can help more women over 40 improve their health.